can be caused by a number of things, one of them reportedly being COVID-19. Court's standing by to learn some expert tips on prevention and treatment.
Yes, we have UC Davis dermatologist Oma Agbai with us this morning. Dr. Agbai, we're trying to figure out what is the connection between the hair loss and COVID-19. Why is it happening?
Well, the key to understanding this is to understand the three phases of the hair growth cycle.
Okay.
There are three phases. The first one is the anagen or the growth phase. This lasts about 2 to 6 years. The second one is the catagen or the resting phase. This lasts a couple of weeks. The third one is the telogen or the shedding phase.
Okay.
And this lasts a few weeks, 6 to 12 weeks.
And I think we have a graphic to kind of show what those phases are.
Yes, we do have a graphic for that. Hopefully that's showing.
Yes.
Awesome. All right. So when there's a major shock to the body, an example could be pregnancy, could be psychological stress, could be COVID-19, a severe illness causing fever. When there's a major shock, it causes some hairs, too many hairs, to shift from the growth phase to the shedding phase.
Okay.
And so this can result in hair shedding that takes place 6 to 12 weeks after the shock to the body. And that's why a lot of people are seeing hair loss associated with COVID-19 or other serious illnesses.
Okay, and so last week, Alyssa Milanos, actress, came out on her own Twitter page and showed the hair loss that she's been experiencing. She's called what doctors are calling a long hauler. She's been dealing with this for quite some time, and showing how much hair she's shedding. And as you mentioned, it's kind of one of the phases there. So does it mean that that you're still infected if you're still experiencing hair loss?
It does not mean you're still infected. This is a stress response. It's not a sign of an active infection.
Okay.
So that's why this is seen weeks to months after the infection has actually resolved. Of course, if a patient is experiencing other symptoms like fever or fatigue or cough, they should let their doctor know. But in the absence of those, when there's hair loss following infection, that's not a sign that you still are infected or contagious.
Okay, so then can this hair loss be reversed or even continue until you lose all of your hair?
The good news is that you don't go bald.
Okay.
You will start regrowing hair. In fact, as soon as the hairs that have shifted to the telogen phase fall out, they are gradually replaced by normal growing hair. So how long does this take? Several months.
Yeah.
It's slow. Hair grows slowly. So this can take 6 to 12 months for the hair shedding to slow down, and then another year or so before the hair thickness gradually returns to normal. Sometimes it does not return to normal, and it almost gets there.
Okay.
So that's something that I address in my clinic in terms of how to support the body to support healthy hair growth after telogen effluvium has occurred.
Okay, and as you mentioned, it goes through phases. So if you know, as soon as you find out, say, for example, that you are COVID-19 positive, is there a way to prevent the hair loss?
Well, if you are prone to getting telogen effluvium, there are certain nutritional deficiencies that can actually make you more prone to losing more hair. So being as healthy as you can is key. A healthy, balanced diet. If you're low on vitamin D, iron, or protein, you can have an increased risk of having more severe hair shedding. So make sure you're getting plenty of these in your diet. Reduce stress as much as you can, easier said than done, and also promote blood flow to the scalp through exercise and through gentle scalp massages. Those things can give your body the tools, the building blocks to support healthy hair if you're sick.
All right, Dr. Agbai, thank you so much for your time this morning. As always, Dr. Agbai deals a lot with hair loss in addition to dermatological issues. So if you would like to get in touch with her at UC Davis and the dermatology department, we're going to link all the information to our website, including her Twitter and Instagram on gooddaysacramento.com under show info and today's date. Dr. Agbai, thank you so much for your time this morning. Appreciate it.
Thank you so much, Courtney. Good to see you.
All right, you as well. All right, Code, back over to you.
Okay.